Hello, everyone, and thank you for tuning in to our new series, the Katz Conversations. I'm Sharon Zarabi. I'm one of the program directors with the Katz Institute for Women's Health. And today I have the pleasure of speaking with Dr. Deligiannidis, who has a mouthful of accolades. She is the professor of the Institute of Behavioral Science with the Feinstein Institute of Medical Research. She is also the director of the Women's Behavioral Health at Zucker Hillside Hospital, and a professor of psychiatry at the Donald and Barbara Zucker School of Medicine. Dr. Deligiannidis, thank you for joining us as the expert in women's psychiatry. Can you share with us a little bit of what motivated you to get into this field?
Sure. Thank you so much for the opportunity. I've always been interested in women's health and hormones and the brain. I would say that those are the three things that I've always enjoyed learning about. In medical school, I was really drawn to psychiatry, to get to know people and understand, how depression and anxiety could affect them and how we could help them. But I also love neurology and obstetrics. I was drawn to, perinatal women, working with them. I love the endocrine aspects of the hormones of obstetrics and also of psychiatry and neuroradiology even. So I chose this specialty of reproductive psychiatry, which is really focused on understanding women's behavioral health across the reproductive lifespan. And that's really around the menstrual cycle, the perinatal period, and the perimenopausal period. And even now I conduct research for the past 15 years in understanding how female sex hormones affect the brain during these periods of time and can cause symptoms of depression or anxiety. So yeah, like my field really brings together all the things that I've, always really loved.
Yeah, so you're bridging endocrinology, neurology, and psychology all in one bucket. So
yeah, I just couldn't make up my mind. So this subspecialty really suited me so well for my interests.
Yeah, well, I think this speaks volumes to me as a new mom. So I could tell you the hormones are real. And I'm just curious, like, what is the most rewarding and challenging experience in this field of work?
Yeah, so I work with mainly perinatal women, so women in pregnancy and after delivery. Also across the menstrual cycle and perimenopausal periods, but especially with my research that's been focused in the perinatal period. And I'd say the most rewarding thing is working with patients, right? I can also do research, on a bench and not work with patients, but I've always, as a physician scientist, loved working with women. And the most rewarding thing I think has been over the past several years, we've had FDA approvals for 2 antidepressants that we helped develop for women with severe postpartum depression. And it's so rewarding to know that women will have more treatment options available because of the research that we've done in this area. And, these antidepressants are not sort of more of the same. They're really different because they're rapid acting. So I would just say to be able to see a woman who's, not feeling herself as severely depressed after giving birth in a matter of days, feel like herself again and be able to bond with her baby, that has just been so rewarding.
That is huge. And I do want to congratulate you because I think everyone should know that you've been doing a lot of research behind this and been awarded for this new pharmacological way of treating this depression that women are usually feeling. So I guess with that is how, when women are feeling so low at this point in their life, they just had a baby or they're, again, a menstrual cycle, all these hormones are raging. How do you provide hope to your patients when they might feel afraid?
Yeah, this is a common piece of it, right? Because feelings of hopelessness, or even not wanting to live can creep in during these hormonal changes. And I would say this is probably one of the challenging parts, right? Is working with women who are feeling their lowest, and wanting them to, helping them to get out of that place. And so I try to create hope by trying to understand the patient's goals for treatment and what they want out of treatment. And with that, explore the possible ways that the future can be better than what they expect, and to work with them on trying to really identify what those things of hope are. And so it's really, I think, my job as a physician to work with women to find hope in any situation, and then identify what's important to that individual woman and have that be our goals, and to instill hope.
Okay. And I'm sure working with this population can maybe sometimes take a toll on you. I mean, you're human and you have emotions and feelings. How do you balance your personal psychological being with
Mhm.
your practice?
Yeah, so it's changed over time. I think where I am right now is I really have fell back in love with exercise. So I love jogging and strength training, especially. That's been new for me. I've always enjoyed jogging, but strength training has been something that just it balances me, not just physically, but emotionally as well, and mentally. It is a way that I can get rid of stress, that I can feel invigorated for the day. So I start my day with exercise. I'm not a marathon runner or anything like that. I jog around my neighborhood, or I keep it very simple, and I, do free weights, but it's so invigorating, and it really keeps my mood really positive and ready to go. I'm somebody who starts my day with a ton of energy, and I think starting my day with exercise really helps. And then, I start my day that way, but also just spending time with family. So coming home at the end of the day and then reconnecting with everyone, making dinner for my family and connecting with my family to hear about their day and sharing with their day is, I think, the way that I've found to get some balance.
Mhm.
The other thing I think is sleep. So I
Very underrated.
yeah, I work a lot and I really love what I do, and so I would cheat and not sleep as much as I should have, and I've learned that that's to my detriment. So I really do get 7 to 8 hours every night now, and it's a priority. The kids know that I go to bed at 10 o'clock, and and that's it. Mom is down; she's down for the count, and I think that's been really helpful to have such full day. But I start and end sort of in that way.
No, I love it. So it's the connections you have with the people you love, your family.
Mhm.
It's the sleep to help give you the energy to get through the day and give back to your patients. And more importantly, you even touched upon strength training. And I don't think
Mhm.
enough women do that because we think
Mhm.
we're going to get bulky. But there is a lot of research that shows when we build muscle, there's this feeling of confidence because we don't
Mhm.
physically feel strong, but we
Yeah.
mentally feel strong. So
Mhm.
I echo you on all of those.
Yes.
And I think it's important just as women because we do have
Mhm.
so many challenges.
Mhm.
Being a mom, being a career-driven woman, a
Mhm.
researcher, so
Mhm.
it's a juggling act.
It
And
is.
just working mostly with women, what do you think are the challenges that women face in our health system today?
So I think there are consequences for women today, from decisions that were made many years ago in research and in clinical medicine. So we know that women's health in general is under researched, has been for forever, for decades. And the consequences have been that we just don't really understand as well as we should, the causes of medical diseases that particularly affect women, that are either more prevalent or unique to women, and or the treatments for women. So that's sort of one bucket. The other bucket, I would say that even medical conditions that affect both men and women are still understudied in women because women were excluded from research for many, many years. And then, in addition to that, I would say that because, like, a consequence of that is that even common medical conditions, like for stroke or heart attack, that they can present differently in women than in men. And yet we were trained in medical school, based on the signs and symptoms that are most common in men. And so there's like this pervasive, disparity that we're trying to right. And it will take time, but we're certainly getting there. And obviously it's, part of the mission of the Katz to do that, to right that wrong, and to really advocate for women's health. And we're doing that by really focusing on women's research, women's health, treatments, and education. Mhm.
Yeah, I mean, you are pure evidence of that pioneering of changing that paradigm just
Mhm.
with the research you've done
Mm.
specifically in women. And you are a proud member of the Katz Institute for Women's Health,
Yeah.
where we have all these specialists who
Mhm.
understand the unique biology and needs of women, just as you expressed. So, you know, you work with women, and there's so many viewers who are watching us today. What would you say are like 2 or 3 takeaways that you want women to do to improve their health, or to know to improve their
Mhm.
health? So nuggets of knowledge.
Yeah, so it's really, it's interesting. As a psychiatrist, we're trained in both medication treatments, for depression, anxiety, and other behavioral health disorders, and also psychological therapies, so talking therapies. But I don't think that we have enough training in or understand the true benefits of some of the things I think that I have found really helpful, like exercise, just being more physically active than you are currently today. There's now more research that physical activity is so helpful for psychological health, in addition to so much of our physical health. So I think that that's one that can be a lifelong, benefit, and that women can choose what they enjoy, and to get benefit out of that activity. The sleep is another one. As a brain scientist, now I really understand the importance of sleep for so many of our body systems, and including our psychological health and physical health. I guess that would be two. The third one I would say is also, because women tend to be so busy and trying to meet the needs of everyone in their lives, sometimes they will miss or be a little late for some of their well women checks or screenings. I think those are so important because we understand that they will save lives and detect things sooner and promote health. And so I would say that those are kind of 3 things that every woman can do to have real impact on their physical health and psychological health.
Yeah, so it sounds like you're asking women, it's a cry to tell us to really
Mhm.
prioritize ourselves, because if we are our best selves, we can take care of everybody else around us. And as we say here at the Katz Institute, is that women are like the chief medical officers of the home. And I mean, again, as you being a hormone researcher,
Mhm.
there's no one better than you to even say that the endorphins that we
Mhm.
feel when we exercise can really change, like, just the chemical makeup
Mhm.
of how we think and how we
Mhm.
feel. And so much of that is how we perform, in our day or with the
Mhm.
people around us. So I think there's so much that we can take out of,
Mhm.
all of the advice that you just gave women. And there's simple things of, getting to bed a little earlier, making some time for movement and exercise. So you got to practice what you preach.
Mhm.
So it's nice to hear that validation. Um, I guess my last question is, it sounds like you do so much for women. What has been the most rewarding part of your career life that you can share with us?
Yeah. Um, so I would say, I mean, life overall would, just be marriage and raising children. I think that that's, the most rewarding thing when you look at overall life. For my career, which is a big piece of that, it's almost, a luxury to be able to do what I do, to work solely with women. I've created a career path that allows me to work with women clinically, but also over the past 15 years to research reproductive mood disorders, as well as, work with women with reproductive mood disorders, and also teach others about reproductive mood disorders and women's behavioral health. So, sort of everything that I do and touch is around this topical area in women's health. And for me, that's being able to pursue my passion in every way. That's just so rewarding, and to move the field, obviously, while I'm
Yeah.
doing all of these things.
Yeah,
So,
no, you are a major trailblazer. I don't think this topic has been spoken about, many years ago. So you've almost paved this new road for clinicians to really understand the brain chemistry in women. So I'm going to get a little personal now and
okay.
rapid fire, just to understand a little bit more about Dr. Deligiannidis when she's
Okay.
in the office or in the research lab. So personally, I guess just being a dietitian myself, I
Mhm.
always love the topic of food. So I'm going to ask you, what's your favorite food?
Oh dear. So Italian food. I love to cook Italian food, read about cooking Italian food, visiting Italy to learn how to cook Italian food and learn about the different foods and where they come from and how they're grown and the different categories and classifications. So Italian food.
Okay, we're going to stay on that topic. So Italian, I think gelato. What's your favorite gelato flavor?
Nocciola, which is hazelnut.
Okay. Favorite city in Italy?
Um, Roma, Rome.
Okay. Favorite place that you've ever visited in the world?
Oh my goodness, that's a tough one. We recently visited the island of Crete in Greece, and that was just
I've been there
phenomenal.
too.
Hmm.
It is beautiful. One
Yeah.
of my favorite places as well.
Yep.
So, and not too far from Italy.
Yep.
I guess favorite vegetable.
Ooh, cucumbers.
Okay. And you said you have a lot of energy. Is there any type of music that you like, any genre specifically that
Um,
helps boost that energy or mellow it down a bit?
yeah, I listen to European pop music. So I stream music from several countries in Europe. It's weird, I know, but I really enjoy it.
Yeah, it's a great way to diversify it. So that's nice. So this was great, Dr. Deligiannidis. I really enjoyed learning more about the work that you do. There clearly is a major difference between men and women with our hormones, with our nervous systems, just with the way we think and feel. And we go through lots of phases in our lives, and that chemistry is altered. So just all the work that you've done, thank you on behalf of every viewer and woman watching this. And I hope to work and see you again soon. If you have any other closing statements that you'd like to make.
I think that's it. I
All
think we
right.
covered
Well,
it well.
okay. Well, thank you everyone for tuning in. We'll see you at our next series with the Katz Conversations.
Thank you so much.